Hello, thank you for coming. How are you doing?
I'm fine.
So please introduce yourself.
So I'm Dr. Rajesh Taneja. I'm a senior consultant urology and robotic surgery at Indraprastha Hospital, New Delhi. So I've been trained at All India Institute of Medical Sciences, and since 1995 I've been in practice. And for the last 12 years I've been doing robotic surgeries, robotic surgery for cancer of prostate, cancer of kidneys, cancer of urinary bladder, and of course, robotic surgeries for non-cancerous, which is called benign pathologies also, which is usually reconstruction of the urinary tract from the kidneys to the bladder.
Okay, that's great. That's nice. So, why did you opt for this specialization? Please share your professional journey till date.
So I did my MBBS and MS from Molano Medical College. And then I shifted to All India Institute for Department of Urology and Urological Training between 1991 and 1994. And January 1995 onwards, I'm in practice. And why I chose this subject was because urology is one of the most wide or versatile subject in terms of surgical fields, because having done masters in surgery from Maulana Azad, you need to do something which keeps you in all subspecialties of surgery. For example, when I'm doing open surgery for cancer, I'm doing a radical surgery for cancer, so I'm an open surgeon. Then I do an endoscopic surgery for the stone disease. I'm an endoscopic surgeon. When I treat functional bladder problems, I'm basically a physician to the bladder, because some people will have frequency, urgency, they will have to get up at night to pass urine, then you have pain while passing urine. So that comes under functional urology. There's no surgery involved. Surgery will be part of it, but then majority of these patients can be treated with medicines, and therefore you are a physician to the bladder. Then there is the specialty of male infertility, which requires microsurgical procedures. Then you have the male sexual dysfunction, which again we go back to a lot of psychology, a lot of endocrinology, which is involved. And so that is how it's a very wide specialty. And talking about reconstruction, so you are a plastic surgeon and you are doing a urethroplasty, which means reconstructing the urinary passage. So you are a plastic surgeon also. So it gives a complete the spectrum of surgical specialties to one person, and that's why I chose.
What are the key treatments you oversee currently?
So the key treatments are basically a large bulk of my treatment is based on robotic surgery for cancers of prostate, cancers of kidney, urinary bladder. So there was a time when we used to remove the whole kidney if there was a tumor. Now we attempt to save the kidney and remove the tumor. So that is possible because of robotic surgery. And then I also do laser surgery for the enlargement of prostate. So all of us, we would have enlightening men in our families. We would wake up at night to pass urine so often. So they are perhaps having what is called benign hyperplasia of prostate. And that does not require robotic surgery. What it requires is laser surgery. So I started laser surgery. I'm one of the pioneers of laser surgery since 2004.
How?
And I've been holding workshops, conducting workshops and trainings things in and around the country, from India to Myanmar, Bangladesh, Thailand, Sri Lanka. So I've traveled a lot and within the country to train people. Now I'm very happy to see that they have now become very good laser experts themselves. That is opening.
That's really nice. So, with the advancement of technology and readily available information, has the relationship between doctor and patient altered?
Yes, it has altered, because the problem is that that there used to be a submission of the patient to the doctor, because when he went to the doctor, he knew nothing, and he would not question anybody. And his source of information was very limited. Today, when a patient walks into my clinic, he has already spoken to his son, who is an IT professional in the United States, who has researched in the last 4 hours whatever I have read in 4 years. And he has passed on that knowledge to the father, and he is sitting in front of me, and the fellow who is sitting in US has already given a question paper kind of a thing so that he can ask you that. I don't mind that. But the problem is, interpreting written text is not easy.
They are like, they have already fitted that thing in their mind.
No, let me tell you something. So we have Indian law, constitution, which is a written book. And we have thousands of cases pending in the courts because 2 sets of lawyers are trying to interpret the law which is written. And they are diametrically opposite to each other. So interpretation of written text is not straightforward. Interpretation of written text can be diametrically opposite. And you cannot interpret text, a written law, because you are not LLB. You have to be a bachelor of law to interpret the written text. Now these people, they have no degrees, yet they feel empowered to interpret medical text. That is the problem. You understand?
Point to be noted. Yeah, I definitely understand.
So what happens is that they do not understand what they are interpreting and how it should be interpreted. And therefore, it creates a barrier between the patient and the doctor, and they look at the doctor with skepticism. And that is not good, because we are surgeons. You have just seen Indian team in the cricket. They won 10 matches, 11 they could not win. Are they going to be held responsible? Are they going to be penalized by the court of law? No. But now, with the information that they have, every patient wants 100% result. A 99% result is not acceptable. That is the problem. Secondly, they want to, because they are all computer experts, they want to push the button delete, and they want the disease to be deleted. They want to put the button save, and they want to save the patient. So that doesn't work. This is real life.
True that. So how do you see the future of Indian healthcare sector?
Oh, it is wonderful.
It's wonderful.
It's wonderful. There is no doubt. I'm very positive because you see the kind of conferences we have, that we are sitting here and we are talking about written things. We are being more transparent. I don't mind being more transparent. What I only tell people is that when you are reading something, you should know that you are perhaps not qualified to interpret what you are reading. So keep that margin in mind and then come. So many times I tell them, okay, this is your disease. Please go back, read about it on the Google, come back to me, and then we can talk. Because that gives them a perspective. Suppose there is a disease which has a poor outcome. When I tell them, they may not believe. When they go back and read and they know that the book says that it has a poor outcome, then whatever I do, intention is safe, then I get the credit. So it works both ways. Knowledge is important. Transparency is important. There is no doubt about it. And I'm glad that the use of the internet is increasing. Only thing is that they have to understand that they are not empowered to interpret it entirely, and they will need my help to interpret that literature. Rather than contest with me, they should team up with me.
Yeah, true that. Oh, this was such an informative session. Thank you so much for coming and sharing your knowledge with all of us.